And welcome to the Dr. Bob Show. The leading cause of death in the United States is cardiovascular disease. Do you know what a heart attack is like? Do you know what it feels like if it was happening to you? Could you explain what a heart attack is like to your next door neighbor? Could you make the diagnosis by talking with them, looking at them, or deciding yourself? We'll be spending most of the time of this show talking about the leading cause of death in the United States and 5 other life-threatening cardiovascular problems, such as, what if somebody had a blood clot in the lungs, pulmonary emboli? What would those symptoms be like? Would it be shortness of breath? Would it be the same chest pain as a heart attack? How about a pneumothorax if the lung collapses and part of the lungs is not working? Or even more important, what we call a tension pneumothorax, where air gets trapped in the lungs, but it keeps expanding, and pushes organs in the chest cage over to one side. Or how about perforation of the esophagus, the swallowing tube? If that perforates, it can cause a very severe chest pain. Or perforated peptic ulcer. There's lots and lots of problems that can cause chest pain that's very similar to a heart attack. Can you make the difference between those? My guest is Dr. Malcolm Foster. Dr. Foster is a board-certified cardiologist, and he deals with what is a life-threatening chest pain every single day. He'll be answering our questions. Along with life-threatening, he'll be talking about how about chest pain that's not life-threatening? How about irritation of the cartilage in the bones, or anxiety or depression? What about a broken heart syndrome? Lots of things we'll be talking about this show. You're going to want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist. We're going to be talking about chest pains that are life-threatening. Each one is very important. Malcolm, welcome to the Dr. Bob Show.
Thank you, Dr. Bob.
Let's go first right into a heart attack. You call it acute coronary syndrome. What does that mean? What's the pain like?
That's right. That's when you have a blocked artery, a blocked heart artery. The pain is very severe. It's tight, heaviness, pressure, usually right in the middle of the chest.
How long does it last?
Well, when it comes and stays, that'll be a heart attack.
Okay, so you know if it's not going away, you better start paying attention.
That's right.
to it. Anything that can go along with the pain, it's a pressure pain right in the middle of the chest.
It can, but it can move. It can move. It can radiate or move out to an arm or the jaw or the throat. Those are all very common. You can have shortness of breath. You can have nausea that go along with the discomfort.
Ladies have different symptoms than men frequently when they're having a heart attack or a blocked coronary artery. What are some of their symptoms that would be different?
Yeah, it's not at all unusual. They may just feel severe fatigue, ill at ease, nausea, this overwhelming sense of doom, but they can't quite pinpoint it that it's the heart.
Do they know it's something going on? Do they have a premonition? Something's happening that hadn't been there before, and I better go see the doctor?
Well, they do, but oftentimes women are homemakers and they stay home. They take care of everyone else. And unfortunately, we see them later coming to the emergency room. So we encourage them, like everybody, if it's possibly a heart attack, to get in right away.
So if somebody's having a pressure pain in the middle of their chest and is not going away, what's the importance of recognizing that right away?
It's very important. We say time is muscle. We want to get a blocked artery open and restore blood flow to the heart. So the person really should call 911 and get in.
So it's real important to reestablish the blood flow. Now, let's switch. Let's go away from a heart attack, from that chest pain, to blood clot in the lung, pulmonary embolus. What's that like?
Well, pulmonary embolus, the most common symptom is shortness of breath, a severe, unexplained, unusual shortness of breath. But there can be chest pain as well, because the right side of the heart is trying to pump blood to the lungs, and that discomfort, it's a heart attack of sorts due to the strain.
So it's a strain on the right side of the
Yes.
heart that's trying to get blood up to the lungs, which is blocked off with a blood clot.
That's right.
Do people have symptoms other than chest pain? Do they break out in a sweat like a heart attack? Do they feel nauseated like a heart attack?
They can, and the heart rate can pick up. The heart's trying to compensate, so their heart rate picks up. They're breathing fast. They're having difficulty breathing. They may also have a blood clot. Usually that clot originated maybe in the legs, so there could be a red, hot, swollen, tender leg. Part of that clot broke loose and went to the lungs.
And when that happens, that's life-threatening.
It is life-threatening.
Now, coughing up blood, do people do that if they have a blood clot that goes to the lungs?
It can. If it causes a lung attack, a pulmonary infarction, then they can cough up blood.
Okay, so if the blood clot is big enough but yet little enough where it blocks up the blood supply to the outside of the lungs, then you get pain, discomfort when you take a deep breath?
You certainly can. It tends to be to one side rather than the other, but yes, you can have pain from that as well.
How is that treated? Is that important to get to the hospital right quick also?
It is, and we use blood thinners and clot buster medications. We'll go in now with catheters and actually remove the clot material.
Yeah, I think that's just absolutely amazing that can happen. So you've got interventional radiologists that can go up and pull out the blood clot?
That's right. That's right. It's very successful.
It must be wonderful for somebody that's in a life-threatening, I'm about to die situation that suddenly pops up and their blood supply is good and they can breathe like a normal person at that time.
That's exactly right.
Pneumothorax. What's a pneumothorax?
That is a collapsed lung. Almost always one side rather than both, unless a person's on a ventilator. But typically, it would be one lung that collapses.
And does that cause pain on one side?
It does. It actually causes fairly severe pain as the lung pulls away from the sac around called the pleura.
And what are the symptoms that person has?
Well, it's pain, usually to one side of the chest, and shortness of breath.
So pain, shortness of breath, that can be pulmonary emboli, it could be a pneumothorax. So you've got to be able to figure out, are there changes on the exam where you can tell if the air's not getting into a certain part of the lungs?
Yes, sir. So with a stethoscope, you can hear and you're missing breath sounds on that side of the chest. A chest x-ray, getting to the emergency room, and a chest x-ray is very helpful. It shows that collapsed lung.
And what is the difference between a pneumothorax, a collapsed lung, and a tension pneumothorax?
That, as you mentioned in the beginning, is where air continues to feed that space, and so it compresses everything. Let's say it's on the left side of the chest, it compresses everything to the right. It compresses the heart and the other lung.
And life-threatening?
That is life-threatening.
How is that treated?
So that needs to be decompressed, and that is a chest tube between the ribs.
Okay, so you got a collapsed lung that's getting bigger and bigger and bigger because it's trapping air, so you just let the air go out.
Yes.
That's an interesting sound.
When it escapes, air comes right out.
Really comes out. And the person suddenly compensates extremely well to that.
Yes, that helps them immediately.
So we've got blocked coronary arteries, crushing chest pain. We've got pulmonary emboli, a blood clot that goes up because causes shortness of breath, extreme shortness of breath. Then a pneumothorax, collapsed lung, tension pneumothorax.
That's right.
How about a perforated esophagus?
Severe pain as well.
Different kind of pain?
Well, it's central, it's in the chest.
Yeah.
And so the esophagus is right behind the heart. In fact, basically it touches the backside of the heart. So the location of the pain is in a similar location. The pain is severe, and there can be further consequences as stomach acid and whatnot get into the chest cavity, and a person can become very, very ill.
Does the doctor frequently know if something bad's going on if the patient comes in, if they've had a perforated esophagus?
Well, they have to be suspicious. Maybe the person has had retching. They've had severe vomiting for some reason and retching, and that may be the tear in the esophagus.
So another tear, how about a dissecting aortic aneurysm? What would that be?
That is where the aorta, the heart pumps the blood to the aorta, and the aorta has a tear in it. It's severe pain that can propagate or extend down the length of the aorta. It can also go backwards to the heart, and that is truly life-threatening.
And how's that treated? It would seem like if you've got a tear that's going on, how are you going to stop that tear?
So it's treated with surgery, either open surgery or endovascular surgery to repair the tear and to maintain the aorta.
Is the long-time results of a dissecting aortic aneurysm usually good if they survive that initial attack?
It is. So either with successful surgery, the threat to the person is early on at the time when the tear or the dissection first happens.
So there's a huge amount of information that goes into somebody that's coming in saying, I'm having chest pain. Is that chest pain ever non-life-threatening?
Yes, it is.
And that's what we'll be talking about. Now, we've got a couple of more life-threatening chest pains, and then we'll go to the non-life-threatening, but to the patient, it's just as serious. You'll want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist. We've dealt with the pain, the chest pain of a heart attack, the chest pain and discomfort from a blood clot going to the lungs, the chest pain that goes along with a collapsed lung pneumothorax, or a tension pneumothorax that pushes everything over to one side, or severe pain with a perforated esophagus, or dissecting aortic aneurysm. That's probably the most difficult to understand what's going on. But the lining of the blood vessel is like a tube, and there are some areas that can get where blood flows through the inside of the blood vessel. That's where it tears and extends down. And then we talked about a perforated organ. We missed the peptic ulcer. So if somebody's got an ulcer and it perforates, that's in the belly, does it cause chest pain?
Well, it can. For example, air with an ulcer, a perforating ulcer where the stomach or the duodenum, it's in the abdomen, but air can get in under the diaphragm of the chest. So they do have abdominal discomfort and tenderness, but they can have air under the diaphragm, and they may feel it in their chest as well.
When there's air under the diaphragm, does that usually radiate to someplace?
It can go back to the shoulder blade.
Yeah, and so that's sort of a tip-off. Now I'm having this pain here, but my belly's hurting, sort of thing.
Right.
Now, we were talking earlier about a broken heart syndrome. What is a broken heart syndrome?
Well, it's a syndrome where the person appears to have a heart attack. So we do an EKG, and it shows the changes of a heart attack. We call it a STEMI. And we take them to the cath lab to see, expecting a blocked artery, like a typical heart attack, but we see the arteries are nice and open. And yet the heart shows evidence of a heart attack. And we realize that they've had intense spasm of the arteries that cause the heart attack. And so they have damage, but typically they will recover pretty well from that.
So what you're doing is they've got pain and discomfort like a heart attack. The electrocardiogram's abnormal.
Yes.
You expect things to be abnormal when you do the cath, but they look normal and the blood vessels are all open up, so something else is going on.
Right.
Is that got a nickname to it?
Right. So the Japanese call it Takotsubo. So it's referred to as Takotsubo or broken heart syndrome.
What's the treatment of that?
Well, it's to take care of the heart. So we put them on medications to take pressure off the heart, like beta blockers and ACE inhibitors, and give the heart a chance to recover, the heart muscle a chance to recover.
Any other chest pains that are very common as far as life-threatening?
Life-threatening. I think that covered most of the life-threatening examples.
So let's go to some non-life-threatening. Let's talk about, I used to call it tsetse syndrome. It's a inflammation of the cartilage in chest cage. Tell me about that.
Very common. So you can also call it costochondritis, or where the ribs meet the sternum, or the bone, your breastbone in the middle. And that can cause chest discomfort. It can be positional. It can be related to deep breath. We press on the person's chest wall and their sternum to see if that reproduces the chest discomfort.
So what usually causes that? Somebody's doing push-ups, or somebody's painting, or somebody's rowing a boat, or they're using the muscles around the sternum?
Yeah, so overuse, weekend warrior. You may not be in the habit of painting a house, and then you paint the house, and come Monday you have this severe chest discomfort.
Sometimes think it's a heart attack?
Yes, it gets mistaken.
And the cardiologist can tell by listening to the patient and then examining and push on the chest cage and say, that's probably not a heart attack, that's costochondritis.
That's right.
How do you treat that?
Well, usually conservative management, but you can use anti-inflammatory medications, and that does help.
How about anxiety? You see a lot of people that, I've had people that had a heart attack in my family, and I'm afraid I'm having a heart attack because I feel short of breath or I feel smothery. What's that like?
Well, it mimics a heart attack. And for example, anxiety or a panic attack, either of those are similar, and the symptoms can be very much like a heart attack. And we do have some false alarms. We see people in the emergency room, which I think is the right thing. We're okay with a false alarm. We want to be sure not to miss a heart attack.
Yeah, so the reason it's okay to have a false alarm is you're not missing one.
Right, better to be on the safe side.
Yeah. What's the electrocardiogram look like with an anxiety attack?
Well, usually just an increase in heart rate. So the heart rate increases, but it does not have the characteristic changes of a heart attack that we see, those ST changes.
Is fear of having a heart attack a big problem?
It is, especially somebody that's had a prior heart attack. And we don't want them to stay at home and stay on the couch. We treat them, and we want them to get back to activity and exercise and a full life.
Do you have cardiac rehabilitation type programs where you encourage people to exercise?
Yes, and that's a wonderful program to do for somebody that's had a heart attack or a bypass operation or a stent.
Depression?
Yes, so it's a heaviness. It's very commonly described as a heaviness in the chest, the same way you can have a heaviness on the back and shoulders and a heaviness in the chest.
So there's lots of things that can mimic a heart attack. How do you, if you recognize it's not one of the 6 major causes life-threatening, you're going to die today if we don't take care of this, how do you evaluate somebody's heart?
Well, we can challenge the heart, so to speak, and that is with a stress test. And that's an exercise test to see how a person does with their heart rate and their blood pressure and their EKG. We might do imaging of the heart. That's with an echocardiogram ultrasound called an echo. And those are excellent tests.
What does the echo tell you? What does it show you?
Lots of information. We see the size of the heart, the thickness of the heart muscle, the heart valves, whether the valves are opening and closing properly, if there's any hole in the heart, fluid around the heart, and a good look at the aorta as well.
So an echo is a very valuable tool for the cardiologist to understand what's going on the heart and how it's functioning. Are there people that are more prone to get a heart attack or pulmonary embolus or pneumothorax or any of the life-threatening chest pains?
Yes, there are certainly risk factors. And so we worry about people that have high blood pressure, people that are smokers, and people that have diabetes and high cholesterol in particular.
And that's what we're going to be talking about when we come back. Are you at risk for having a heart attack or a serious life-threatening chest pain problem? We'll be teaching both of us what we can do to keep that from happening. In medicine, we frequently talk about lifestyle changes. Lifestyle that we have to change in order to get healthier. We talked about with the life-threatening chest pain that we need some lifestyle changes. Let's talk about what we tell the patient to do to be healthier, not to have these problems.
All right. I would say at the top of the list, no smoking or vaping.
Smoking and vaping. What do they do to the blood vessels? What does cigarette smoke do to damage the heart?
Well, it damages the lining of the blood vessels and it increases blood clots.
So if somebody's a smoker, stop it.
Completely.
If they have difficulty stopping it, are there ways that they can be guided towards cessation of smoking?
Yes, and they should try and keep trying, figure out what works for you to get off completely.
Okay, so we've got to get off smoking. You mentioned blood pressure?
Yes, so we need to control blood pressure and blood sugar and blood cholesterol. We want all of those under control.
So those are numbers that we have. We have blood pressure numbers. Have good medicines to control blood pressure?
Excellent medicines.
Yeah, and so the doctor can guide toward normal blood pressure. How about blood sugar? What can we do about that?
We have, again, excellent medications that help to control blood sugar. Of course, this goes along with healthy diet, exercise, and keeping the weight down.
Is that not too hard on somebody to say, hey, you got to change your eating habits, you can't smoke, you can't do this? Or do you tell people, hey, you can enjoy life with exercise and eating better foods?
Exactly. You'll feel better. You'll feel better. You'll be happier.
When people lose weight, do they feel better?
They do.
You like to look at yourself sometimes.
Absolutely.
Sometimes you don't like to look at yourself. But when you get thinner and you get more in shape, there's really a lot you can do. So blood pressure, blood sugar, well, what's a normal blood sugar?
Well, fasting, first thing in the morning, less than 100.
So if it's over 100, then you've got to worry?
You should start to track it carefully, yes.
And you mentioned one other thing, cholesterol.
Cholesterol. And we have different goals and different thresholds, but if you have heart disease, for example, or cardiovascular disease, we do want to drive those cholesterol levels down very low.
And where does cholesterol fit with heart attacks, heart disease?
It has to do with plaque buildup, is mostly cholesterol plaque buildup.
So it's the plaque that builds up in the vessels that make them narrow, that fill up the vessel, that causes the heart attack, and then you've got problems.
That's right.
Big problems right here in East Tennessee.
Indeed.
So is East Tennessee a difficult part for people as far as healthy living?
Yes, we have a long way to go. We have a long way to go with health habits, and we have a lot of people that are overweight. We have a lot of diabetes. We have a lot of risk factors that need addressing.
Do you think the public is doing a good job of addressing lifestyle changes even though they haven't had a heart attack?
We've made progress in some areas, but in other areas we honestly have gotten a little worse. So again, more overweight, more diabetes. So we have opportunity for improvement.
I see a lot of talk in the medical circles about the word mindfulness. That's where you start paying attention to your blood pressure, your cholesterol, your smoking. You're taking time for yourself, taking deep breaths, relaxing, doing some things with the family, do some things that are fun rather than the stress of life. And life can be very, very stressful.
Yes, sir.
Can you pick that up when you're seeing patients in your office?
Indeed. And in fact, I encourage, for people of all ages, I encourage things like yoga and relaxation, meditation, and good social interaction, good healthy interaction.
You know, it's getting to be more and more and more important. What's your philosophy of why that helps not having a heart attack?
Well, I think it lowers stress levels, and stress levels can be a trigger for a heart attack.
Weight, losing weight, is that any keys to helping people doing that? You got to exercise, you got to eat better. You got to be sleeping well. We'll talk about those things
all
when we
of
close
the above,
show.
yes, sir.
And so all that's really important. Reviewing the 6 causes of life-threatening chest pain. What's the pain like with a heart attack?
Severe, sweaty, clammy, nauseated, and short of breath.
What's the pain of a blood clot in the lungs?
Mostly shortness of breath, also some aching chest discomfort.
Pneumothorax, collapsed lung?
Severe pain on one side.
And a ruptured esophagus?
severe pain like a sword through you, and you get very ill after that.
And dissecting aortic aneurysm.
Also a severe tearing pain.
You're a great teacher, and you do such a wonderful job of letting us know what those pains are like.
Thank you.
Thank you for coming to the Dr. Bob Show. Thank you for educating everybody, and look forward to seeing you back again.
Thank you, Dr. Bob. I appreciate it.
And now that's all the time we have for this show. Remember, exercise is an important part of staying healthy. You need to get your tennis shoes out. You need to walk, or you can jog, or you can row a boat. You can do anything. You can work in the garden. Just be sure that you do it for 30 or 45 minutes, 5 days a week. Start the day off with a good breakfast of fruit and fiber. Make your eating habits better. As your eating habits improve, you'll find that your life improves. 7.5 hours of good sleep. If you're snoring or you have sleep apnea, you need to talk to your doctor about what you can do. It's a life-threatening situation. And most of all, in the mindfulness, it's that laughter in your life. Find somebody that you like to enjoy and that you like to laugh with. As you laugh, your life will be more exciting, will be more fun, and you'll stay a whole lot healthier.